Hi, this is Dr. Kathleen Russo with Carolina Healthspan Institute. I'd like to thank you for attending today's educational program. I'm going to be talking about vitamins and supplements. So first, let's talk about nutraceutical versus drugstore brands. First, we have to look at bioavailability. Nutraceutical or pharmaceutical grade products tend to have more bioavailability than drugstore brands, and that bioavailability does vary significantly on the market. Pharmaceutical grade ingredients are more likely to have more rigorous testing, which ensures that you're getting the safest and the highest quality product. Also, nutraceutical or pharmaceutical grade products seem to have higher doses of the nutrients and therefore better at treating a deficiency. And nutraceutical grade products also tend to have more of the biologically active ingredient, which provides superior absorption. Some examples of these considerations is when you look at fish oil, for example. Fish oil, the prices vary from $10 a bottle to $40 a bottle. And one of the things that you'll note is you look on the back of the bottle and look at the individual ingredients, you'll see that the amount of EPA and DHA varies dramatically from one product to the other, particularly when you're comparing a drugstore brand to a pharmaceutical brand. Well, the DHA and the EPA are the active ingredient, and a lower grade product tends to have less of this active bioavailable ingredient versus a more higher grade nutraceutical grade product. Additionally, with a product something like fish oil, you want to have a product that's made from fish that are low on the food chain, sardines and anchovies. These type of fish tend to have less contamination as opposed to a bigger fish that has multiple levels of contamination. So why would one want to take supplements? Well, for specific conditions such as digestive disorders, mood disorders, autoimmune disease, hypertension and other cardiovascular disease, sports optimization, and even weight loss. Additionally, some medications can deplete essential nutrients, making people more vulnerable to deficiencies. With respect to digestive disorders, constipation, IBD, gastroesophageal reflux, dysbiosis or a dysregulation of the good and the bad bacteria in your gut, a permeable gut barrier such as leaky gut, chronic bacterial, parasitic, or fungal infections, digestive enzyme production that might be deficient, therefore perhaps not breaking down dietary protein, for example. Maybe someone has a sensitivity, an allergy, or an intolerance to certain foods, or impaired communication between the brain and the gut. We do know in emerging research that there is a very distinct brain-gut communication, and this communication is bidirectional. So the gut health absolutely does affect brain health. Digestive enzymes and liver support. So digestive enzymes break down larger food molecules into smaller molecules. The trouble digesting high-fat meals presenting as gas and bloating after a high-carbohydrate meal is an example. Super enzymes, 2 capsules per day with meals, is a product that we recommend and seems to be very helpful. Nutrients to restore gut barrier. We spoke just in the last slide about a leaky gut. The intestinal lumen is separated from our system or our blood system by just one cell layer. And between those cells are tight junctions. And one could have a permeable or leaky connection between those cells, which allows for bacteria and larger proteins to leave the lumen of the intestines and get into our system. And that creates an immune response which triggers inflammation. And we know that inflammation is a root cause of not only autoimmune diseases, but also some certain cancers. There's a product called GI Repair that is a comprehensive support for optimal GI health. Probiotics. Most of us have heard of probiotics. They are live microorganisms, and what they are is bacteria, good bacteria, that repopulate our gut with the good bacteria and thereby killing off the bad bacteria. Probiotics can reduce inflammation. They're helpful in treating diarrhea and constipation. They improve the immune system. They reverse lactose intolerance, reduce anxiety, and improve cognitive functioning. As you may remember, I spoke about the brain-gut connection, and we do know that depression and anxiety and cognitive impairment are inflammatory-based conditions and are definitely influenced by the health of our gut. When we're talking about probiotics, there are choices, and typically there must be 3 criteria that are met. It must contain strains that are normally found in the human gut. It must also be able to survive the acidic environment of the stomach and capable of colonizing the GI tract. And the probiotic must be supplemented in concentrations higher than what it is found in the gut. Hypertension is another disorder that we can use supplements to treat. CoQ10 is a supplement that we recommend, 100 to 200 milligrams a day. It reduces systolic blood pressure by 15 millimeters of mercury and diastolic blood pressure by up to 10 millimeters of mercury. Vitamin C, 500 milligrams twice a day, has been shown to modestly reduce blood pressure and improve arterial health. Magnesium, 400 to 1,000 milligrams a day, over an 8-week period has been shown to significantly reduce blood pressure. I recommend magnesium glycinate, that's Glycinate, for optimal absorption and tolerance. And then, of course, fish oil, 1,500 to 3,000 milligrams a day. Fish oil has been shown to reduce blood pressure. It's also very helpful in cardiovascular disease, which I'll speak about in a moment. So cardiovascular disease and dyslipidemia, or abnormal lipid profile, cholesterol profile. So magnesium, it prevents platelet aggregation and blood clots. It vasodilates the blood vessels and prevents an irregular heartbeat. Vitamin D3, it regulates the immune system and reduces inflammation. And studies suggest that vitamin D deficiency increases the risk of heart disease. Vitamin K2, this helps keep calcium in the bones and the teeth where it belongs and out of soft tissue like the arteries. Vitamin C helps maintain adequate levels of glutathione, which is the master antioxidant in the body. Glutathione deficiency is associated with increased risk of heart disease. Fish oil has multiple beneficial effects on lipid profiles. They're anti-inflammatory, they prevent blood clots, and they lower blood pressure and heart rate. Curcumin has been shown to improve serum lipids and has been shown to lower blood sugar, improve antioxidant activity, and reduce the oxidation of the LDL particles. CoQ10 is an antioxidant that carries electrons in the electron transport chain during the synthesis of ATP, and that's helpful to the heart. And then bergamot is a citrus plant that contains powerful cholesterol balancing and cardioprotective benefits. Depression, anxiety, and other cognitive disorders. These brain disorders are complex conditions with distinct causes. However, recent research suggests that they share at least 3 common factors. One is inflammation. Number 2, they are influenced by gut health. The term gut-brain axis describes the close connection between the gut and the brain. And they are strongly influenced by nutrient composition and balance in the diet. So vitamin B12, 1,000 micrograms injectable or 5,000 milligrams sublingual. DHA, 800 to 1,200 milligrams. Phosphatidylserine determines which nutrients can enter brain cells, how waste gets out of brain cells, and how cells communicate. It improves memory, it improves learning, concentration, and mood. The recommended dose is 100 to 300 milligrams. Curcumin protects brain cells from oxidative stress, it improves memory, it decreases inflammation. 5-HTP, 50 to 200 milligrams. This is the immediate amino acid precursor to serotonin. It has been shown to increase serotonin levels, which can improve mood and sleep. It promotes restful sleep because serotonin is a precursor to melatonin. And did you know that 90% of your serotonin is made in your gut? Again, illustrating the brain-gut connection and how gut health can influence brain health. And then SAMe, 400 milligrams to 1600 milligrams, is effective in improving mood, and several trials have shown that it can relieve depression with few side effects. Okay, let's talk about supplements for anxiety and insomnia. Kavinase is a product that helps improve GABA levels. GABA, G-A-B-A, is the major inhibitory neurotransmitter in the body. Many people with anxiety have low levels of GABA. Kavinase contains a GABA derivative that crosses the blood-brain barrier. Along with taurine and vitamin B6, this formula calms nervous tension and anxiety. I recommend 2 capsules once or twice daily. Vital Nutrients has a product called Sleep Aid, and it's a combination product that contains valerian root and passion flower. And these two herbs have been shown to reduce anxiety, restlessness, and insomnia. L-theanine, 100 to 200 milligrams a day, particularly when combined with Simorelin. This is an injectable that you take at night, and it promotes very deep sleep. And I'll be talking about Simorelin towards the end of this presentation. Let's talk about weight loss now. Vital Nutrients does have a product called Blood Sugar Support. It contains alpha lipoic acid, chromium, magnesium, and EGCG. So this is a supplement that can improve blood sugar regulation and optimize fat burning capacity. The alpha lipoic acid, the chromium, magnesium, and the EGCG, all in the Vital Nutrients product, is a blood sugar support product. Probiotics are helpful in weight loss. In our gut, we have 2 dominant bacteria. We have Bacteroides species and we have Firmicutes species. Firmicutes species are very efficient at pulling calories out of our food. And that's something we don't want because the body will then store those calories in fat cells. Bacteroides species, on the other hand, is very efficient at fat burning. And so we need to have a very good balance, a proper balance of Firmicutes to Bacteroides species. And probiotics can help us do that. So in a sense, probiotics, they're not actually a weight loss drug, but they do promote weight loss by making our bodies more efficient at fat burning. Also, HCG injections, that's human chorionic gonadotropin, which is a hormone that's produced by the placenta. It is something that both in men and women can take. There's several different protocols, but essentially what HCG does is it pulls fat out of fat cells, and then our body uses that fat for fuel. So while on HCG, one consumes a very low-calorie diet, but they don't feel the tiredness, the fatigue, the calorie deprivation that one might otherwise feel because the body does have fuel. It's using your fat as fuel. And then there is a compounded capsule that we can prescribe for you. It has some phentermine, which is an appetite suppressant, DHEA, which is a hormone which helps with muscle building, and calcium pyruvate, which helps with fat burning. So these are all things that you can talk to your healthcare provider about whether or not they would be appropriate for you and helpful if weight loss is something that you would like to consider. Let's talk a little bit about autoimmunity now. Autoimmunity disease manifests differently. Things like Crohn's disease can affect the GI tract, while multiple sclerosis affects the nervous system. A compromised gut barrier is a common finding. So L-glutamine is essential for healthy intestinal cells, and it's essential in maintaining proper intestinal barrier function. MSM and quercetin. These are anti-inflammatory substances that can reduce chronic inflammation, which is a major cause of leaky gut. N-acetylglucosamine, NAC, helps support proper health of the gut mucosa, and it reduces intestinal permeability. Mucin protects the intestinal lining and reduces inflammation. Then there's some other herbs, DGL, slippery elm, marshmallow, chamomile, and cat's claw. There is a product made by Vital Nutrients. It's called GI Renew, and it provides L-glutamine, N-acetylcysteine, MSM, DGL, slippery elm, marshmallow, chamomile, okra, TOA, free cat's claw, quercetin, and mucin. So that's a nice product that combines all of these herbs. And then glutathione, I want to mention it. It's the master antioxidant, and it supports healthy T regulatory cell function and thus plays a crucial role in balancing and regulating the immune system. Glutathione is a tripeptide, which means it's a molecule composed of 3 amino acids, glycine, cysteine, and glutamate. And when glutamine is taken orally, these amino acids are broken down and absorbed individually, which means the glutathione molecule is not absorbed intact into the cell. So you need to use glutathione precursors like NAC to increase glutathione. Okay, curcumin benefits the immune system also. It promotes T regulatory cell function, it reduces inflammation, and it protects against oxidative damage. Fish oil and probiotics. Vitamin D3, 4,000 to 5,000 IU a day. Vitamin D3 has a very large impact on the immune system. In fact, there are receptors throughout the body for vitamin D3, and there are studies that show that women who supplement with vitamin D3 have reduced levels or reduced risk for breast cancer and colon cancer, and in men, colon cancer and prostate cancer. Vitamin D, of course, is good for your bones also. It's been implicated in autoimmune diseases such as multiple sclerosis, Parkinson's disease, SLE, which is rheumatoid, lupus and rheumatoid arthritis, and other neurodegenerative diseases. And then I want to comment on low-dose naltrexone. It's not really a supplement, it's a medication. Low-dose naltrexone addresses the underlying cause of autoimmune disease. It increases endorphin levels, which in turn promotes T regulatory cell function. So low-dose naltrexone is fairly new treatment for autoimmune disease, but there are already several promising studies suggesting that it's effective for Crohn's disease, multiple sclerosis, fibromyalgia, and cancer. So that's something I'd like you to speak to your healthcare provider about if this is a concern for you. Dr. Brown, myself, Ms. Solomon are all very excited about the emerging research for low-dose naltrexone. Sermorelin. Sermorelin is a peptide. It's similar to growth hormone releasing hormone, and it stimulates the pituitary to produce or secrete growth hormone. So the benefits include it increases bone density, it increases muscle mass, improves ability to burn fat, it increases sex drive, regenerates nerve tissue, strengthens the immune system, enhances energy level, and improves cognition and memory. Its benefit profile is that of growth hormone because what it's doing is increasing or stimulating your own natural production of growth hormone. And typically what we see over time is week 1, we see improved quality of sleep. And you'll remember I may have mentioned that we can combine sermorelin with L-theanine for sleep. Week 2, we see improved recovery from workouts. In week 4, we see more mental clarity. Week 6, we see improved skin and elasticity. And in week 8, we see improved body composition. So the goals of supplementation is identify your deficiencies, We can do that by laboratory testing, by analyzing your diet, and looking at pharmaceuticals. So regarding pharmaceuticals, there are medications that can deplete nutrients. And for some examples, acid-reducing drugs, we know, it's very well known that reduces vitamin B12 and folate. We also know that statin drugs severely deplete CoQ10, which can increase our risk for congestive heart failure. It causes muscle weakness and some other issues. So if you're taking certain medications, be sure to talk to your healthcare provider about that, and recommendations can be made that can replete those deficiencies, and perhaps using testing to identify how severe those deficiencies are. You can use supplementation to address specific concerns and specific risk factors. We may have genetic need for more supplementation. For instance, some people might have a methylation defect, and that's something you could talk to your healthcare provider about. That would be something we'd want to supplement if you have that genetic predisposition. We always want to use food as our primary treatment strategy whenever possible, but sometimes we need some supplementation.